Francis, how would a dental assistant respond to a question from a patient about the risks of dental x-rays?
Well, Jim, it should be emphasized to the patient that the risk of not having the x-ray far outweighs the actual radiograph itself if it's needed for their benefit.
Are there any recommendations to suggest how much radiation a person should limit themselves to?
Based on the current information, the federal government's published recommendations, which are called the Maximum Permissible Dose, MPD, guidelines, and these are for the general population, for radiation workers, and for pregnant women. The MPD is the greatest amount of radiation exposure that's not expected to produce significant biological effects. These levels are subject to modification as more knowledge becomes available.
Francis, why is it that pregnant women are in a separate category within the MPD?
During the 9 months of pregnancy, and especially during the first trimester, the fetal cells are highly susceptible to harm, and this can come from physical, chemical agents, from radiation itself. And because there is that potential harm to the fetus, the doctor's responsibility is to weigh all the risk factors and to make sure that the radiograph is more important than the harm that they would get. The dental assistant's responsibility, on the other hand, is to avoid any unnecessary radiation, and they should strictly follow the radiation safety guidelines, and one of the ways they can do that is to shield the patient with the lead shield, and in particular in the uterine area. The most important thing they could probably do is to make sure the patient does not have to have any radiographs repeated, just to take the exposure right the first time.